Hello, this is Dr. Adam Kopsky from Advanced Rehab and Medical in Jackson, Tennessee, and today I'm going over our topic of the week that we actually had last week and still going on this week, and it's actually a topic that doesn't get much discussion in the chiropractic world, and it relates to hip pain, and specifically what it is femoral acetabular impingement, or in layman's terms we call it just hip impingement. So a lot of you may notice if you've seen me and have a lot of shoulder issues, I love the shoulder, I also love the hips, and so one of the things about extremity work, meaning everything outside the spine and our extremities, that a lot of people have impingement in the shoulder, which a lot of times when you lift overhead you get impingement here, which is very common, but we also can get impingement of the hip. And I just want to briefly discuss what that is and some signs and symptoms and what you can do to help alleviate that and to just be aware of it. So one thing is, if you look here, what actually happens is, and this is a picture of your hip joint, and it goes through the three different combinations of what happens. And so this is your actual femur head coming into your hip joint itself, and the outer layer we call the acetabulum. And so a lot of times how we actually get this is through childhood when we're growing. So this condition is more common in athletes as you're growing. And so what happens is we're growing, sometimes we can have a mismatch between the actual acetabular rim or the femoral head, neck, or the shaft. And so the first one that we call is a pincher, and you can see this little bone coming out. That should not be there. And actually what happens is you have an overdevelopment of the cartilage, which is the labrum that promotes stability of your hip joint itself. And so if that starts growing over, you can actually get impingement there, and so you may notice when you walk some clicking, locking up, and just actually pain if it gets too severe. The other one that can happen is what we call a cam lesion, which if you see here, you get some overgrowth of the actual femoral neck here, and that can rub into the hip joint itself and cause pain. However, the majority of these cases, of 80% of them, are actually a combined pincer and cam lesion. And so one of the things I want to discuss next week is if you come back on simple exercises and tips you can do at home to help keep this stress down, because they're actually, once you get it, if we can't manage it correctly, it does end up looking into a surgical situation that needs to be handled by an orthopedist. But sometimes, you know, the whole key is stress and imbalance biomechanics. So if we can alleviate that, we can actually help manage that and prevent it from getting worse to help keep you from having to go down a surgical road. Okay, I hope this helps. If you have any questions, please comment in this post below, and I hope you guys have a great day.